Good morning. My name is Heather Cox, and I'm here to talk to you about the things you need to do for medication administration. You do have other videos that show how to give IM injections and sub-Q injections and how to give oral medications. What I'm here this morning to emphasize to you is the rights of medication administration and how to go through your 3 checks and make sure that you give medication safely. I'm now outside the patient's room, so the first thing I'm going to do is I'm going to foam in. And I'm going to go ahead and pull the curtain and provide for patient privacy. And as I enter the room, I'm going to go ahead and perform AIDED. Good morning, Mr. Smith. How are you doing this morning? My name is Heather. I'm going to be your nurse, and I'm going to be coming in and giving you some medications. Can you please tell me your name and date of birth? I'm going to check with his armband at the same time as he states this. I'm doing the check with his armband to confirm that what he tells me is correct, and I'm also getting him to say 2 patient identifiers. I'm going to be looking at his armband to see if there is any coloration on it. Most of your facilities will either have a white armband with your patient information and a little red tag if your patient has allergies, or the armband may be red if they're allergies. Make sure you check with facility policy. At this point, I'm going to ask Mr. Smith if he has any allergies, and he tells me no, and that is consistent with what his armband states. So at this point, what I have done is I've come in and I've acknowledged Mr. Smith, and I've also checked his allergies. I've identified the patient, and I've also identified myself. Now I'm going to go ahead and explain to Mr. Smith what I'm going to be doing, which will include the duration and the explanation of the AIDED piece. Mr. Smith, I'm going to be coming in and giving you your morning medications. It'll probably take me about 15 minutes to do this. At this point, I would probably take the time to discuss the reason for the medications, and I would perform any assessment data that I needed to do before I gave the medications. I'm also going to do the education in regards to those medicines and make sure if there are any medicines that he wants to refuse, and I'm going to discuss those things with him. Mr. Smith, do you have any questions about your medications this morning? And he says he wants to know which medications they are. And so I'm going to pull them out first, and then I'll discuss them with him and do education and things as I'm doing it. One of the medicines that I'm going to be giving him this morning is digoxin, and that does require that I do some assessments on him. So at this point, for digoxin, I would need to listen to an apical heart rate on him and make sure that it met the standards of the facility. You want to make sure when you're going through and looking at your documentation system, be it computer or the medication administration record, or MAR you may hear it called, that you address any warnings as you're going through. A very common warning for digoxin is that you don't administer it if the pulse is less than 60. So I would have listened to his pulse apically, certainly with my stethoscope. I've confirmed that his pulse rate is in the 70s, so we're fine. If it's applicable, I would also get some blood pressure readings. There may be medicines that might change, the way his bowels work or some of that. I might have to listen to bowel sounds or anything. So I've already done all my pre-assessments, and I need to know what the medicine is for or the right reason. I need to have done the assessment data, and I need to know if he is okay with me administering. He said he's fine with that. So now I'm going to go ahead, and I'm going to move over here to where the medications are kept. In most facilities, you will probably have a locked box on the wall, or they will be kept at the patient's bedside in a locked manner. So these drawers would be locked and closed and all of this kind of stuff. In some facilities, the medicines are kept out in the Omnicell or other locations, so make sure you know your facility policy and where the medicines are before you actually get into the patient's room. At this point, I'm moving over here, and I'm going to go ahead and I would open up, use the key, whatever it is that I need to do, and I'm going to pull out the medications. And what I would be doing is I need to also be looking at the computer at the same time, or the paper medication administration record. I'm going to now go through with the computer. So as soon as I go in, I'm going to log into the computer, and you need to make sure you go by your facility policy. Most of your facilities will either allow you to pull the patient up through the computer using the actual mouse, or you can come over and you can scan the patient's armband and actually pull the patient up in the system. Once you get the patient pulled up in the system, you will go to the screen that addresses the medications. Once that screen comes up, now I'm going to go ahead and go to my drawer and pull out the medications that are appropriate for my patient. As I'm pulling out the medications, this is considered my first check. And the things that I need to be checking the medications for, I would need to be making sure that this is the right medication, that it's the right dose of the medication, that I'm going to be administering it by the right route, I'm giving it at the right time. I would reconfirm my patient before I give the medication, and finally at the end I would be doing the right documentation. Those are the main 6 rights of medication administration. The other rights being the right reason, the right assessment data, the right patient education, the right to refuse, and the right response. Now, some of those things I've already addressed. Some I will address at the end. Some I address all along the way. So as I'm going through, I'm going to pick out the medications that are due for Mr. Smith. And we're going to say that as I've looked at his medication administration record this morning, he is due for 2 medications. I'm going to say that he is due for digoxin, 0.25 milligrams, and he's due for Prenavil or lisinopril, 40 milligrams. I have confirmed the first check here as I'm looking and I'm pulling them out and comparing to the computer. I'm now going to come back over here and perform my second check when I go through and I'm going to scan the medications. Whenever you go through and you do this, you have to make sure that you scan each medication individually. So the digoxin, as I'm looking at this, I always make sure and look at the expiration date as well to make sure that the medication is not expired. So I'm going to go through and again, the right medication, digoxin, the right dose, 0.25 milligrams, the right route, I've confirmed that it's supposed to be given orally, the right time, these are medications ordered at 9 o'clock for Mr. Smith. I usually have a 30-minute window for medications, either 30 minutes before, 30 minutes after. So if they're ordered at 9 o'clock, I could begin as early as 8:30 and end as late as 9:30 without the medications being late. I'm looking at the expiration date in here, and of course I'm going to verify Mr. Smith again here before I give the medications. I would then at this point scan the medication. Now with the Prenavil, if you look at this, I'm going to give a total of 40 milligrams of Prenavil. These are each 20 milligram tablets of Prenavil. So what I need to do is make sure and go through and scan each medication individually. And once I scan that one, again, confirming the right medication, the right dose, the right time, the right route, expiration date. Then I'm going to come over and scan the second dose of the Prenavil. I have now scanned each medication individually and confirmed for my second check. If I ended up having to draw out any medication from whatever the original package was, then I would need to make sure that I labeled it. I'm not going to have to do that with these medicines because they're already in a pre-package, they're already labeled, everything is good. But let's say if I was giving like an IM injection and I needed to give the medicine and draw it out of a vial. Anytime I take something out of its original package, it must be labeled at that point. I've now scanned my medications. I performed my second check. I'm now ready to give the medications to Mr. Smith. So what I'm going to do is I'm going to go ahead and again confirm my patient. Mr. Smith, would you please mind telling me your name and date of birth again? Again, as he's stating it to me, I'm going to compare it to the armband. I'm going to scan the armband. I have used 2 patient identifiers to verify my patient. At this point, whenever this comes up, I should have addressed any warnings all along the way as already discussed with you in regards to if the digoxin needs to be held for systolic blood pressure, less than 90, or if it needs to be for the heart rate less than 60. I need to make sure that I've addressed those. I've done any pre-assessments that might be necessary. Some pre-assessments also that might be necessary would include how Mr. Smith does with swallowing, and then also any orders. So for instance, I would have needed to have made sure that I had orders for all of these medications and verified those before I came into the room. And I also need to look at his diet order. Is he MPO? Is he MPO except medications? Is he full diet? And then, like I said, as he's doing his swallowing, I would need to make sure that I had fresh water in here at the bedside and I had assessed if he had any issues with swallowing. I'm now ready to perform my third check, which is right before I give the medication to Mr. Smith. And so what I'm going to do again is come back and look and compare these again to either the paper medication administration record or to the computer and confirm again the right medication, the right dose, the right route, the right time, the right patient I've just confirmed, and then we'll document at the end. As I'm going through these medicines, if I have not done my patient education at this point, then I could go ahead and speak to Mr. Smith about these. Mr. Smith, I'm going to be giving you some digoxin. This is actually to help control your heart rate, and it helps your heart function more efficiently. Do you have any questions about this medication? And Mr. Smith tells me he's been on this medication at home for years. Another thing that you want to talk to your patient, have they taken these medicines at home before? Have they just been started on these medications while they're in the hospital? As you're discussing the right reason, and then the right assessment data and the patient education for these. And I would also make sure if he's willing to take these medications, so he has the right to refuse. He says he's willing to take the digoxin, so at this point I would open up the medication individually and put it in whatever cup that I have. I would make sure that he has his water or whatever liquid he wants to take his medicines with. Also make sure that he is up at least in a semi-Fowler's or high Fowler's position. Sometimes your patients may not be able to sit up, so you may have to give them the medicines in a sideline position, but make sure you assess the swallow reflex before you do that. Certainly I would go ahead and I would give him the cup and he would take the medication. I need to make sure that as I give him the medicine that he completely swallows it. You always need to make sure that you do not leave medications at the patient's bedside. That is inappropriate. Once he's gotten the first pill down, then I could certainly open the next pill and give him that medication as well. And then I could give him the third one. Now, some of your patients like to take more than one pill at the time. You need to make sure that you discuss this with the patient before you start administering the medications and see how they like to take their medications and then how they've done with their swallowing. He has now taken these medications. At this point, I would dispose of the wrappers or containers according to facility policy. I need to make sure again that he's not having any issues with swallowing or taking the medications. And then I need to go through and I need to come back in probably in about 30 minutes and make sure that the patient is getting the right response from the medications. Certainly with the digoxin, I might well see a lowering in the heart rate. And then with the lisinopril, this one could affect his blood pressure and his heart rate. And you need to know your individual medications and the reason for them so that you could correlate the assessment data and then the response. I need to now ask Mr. Smith if he needs anything else from me. He did okay with his swallowing. He says that he's doing okay here, so the rest of the stuff that I need to identify would then be safety and the 4 P's. So I need to make sure, number one, is his bed in the lowest position? Is it locked? Does he have his call bell? Is his table within reach? Does he have any other needs? For the 4 P's, the proximity, all of his stuff is within reach. Is he having any pain? Do I need to address any of those things? Is he in the proper position? Do I need to lower him down? And does he need to potty? Do you need to go pee or, do anything before I end up leaving the room? Ask him again if he has any other questions. And then I would certainly thank Mr. Smith for allowing me to come in and care for him this morning and give him his medications. Thank you very much, and I hope this has been useful. Good morning, my name is Heather Cox, and today I'm going to talk to you about how to assess a gastric tube for placement and to make sure your patient's not having complications, and I will show you how to administer a bolus tube feed and discuss a continuous tube feed as well. I'm now going to start and enter the patient's room, so I'm going to foam in whenever I come in. I'm going to go ahead and pull the patient's curtain here to provide for privacy, and as I enter the room, I'm going to practice aided. Good morning, Mrs. Smith. How are you doing today? My name is Heather. I'm going to be your nurse. Can you please tell me your name and date of birth? And as I ask her to repeat that, I'm going to look at her armband, and I'm going to confirm with 2 patient identifiers that what she's telling me matches her armband. Do you have any allergies? And Mrs. Smith says that she does not. So I have now acknowledged my patient and checked for allergies. I've introduced myself, and I've identified the patient. Mrs. Smith, I'm going to be in here with you performing an assessment and looking at your tube. I understand that you have a gastric tube down there, and then I also need to give you a tube feeding as ordered by the doctor today. It's probably going to take me about 15 minutes. Do you have any questions? So I've now gone through the duration and the explanation of the procedure. As I'm doing this, I could do any patient education at this moment, and I could explain to her the purpose of the tube feeding. One reason the patient might end up having a gastric tube, it might be that they've had some type of throat surgery or mouth surgery. It could be that they're failure to thrive. They're having issues with weight gain. Maybe they have some type of cancer, gastric issues, some of those kind of things. And so it could be that we need to bypass the upper system up here to be able to move to gastric feedings, but the goal is always to maintain the gastric system and the functioning. So if we could give gastric feedings, that would be better certainly than giving the feedings by the IV. Mrs. Smith, I'm now going to go ahead and I'm going to move down to your stomach and I'm going to take a look at it, and we're going to look at your tube to make sure everything looks good. Have you been having any issues or any pain? And she says that she's not having any pain. Have you been throwing up or having any nausea? And she says no to these. These are common assessments that you need to do. You need to make sure that she's not having any abdominal distension, she's not having nausea and vomiting, no pain. I'm also going to go through and I can measure her abdominal circumference by using a tape measure and measuring completely around the stomach of the patient at the level of the umbilicus. Miss Smith, I'm now going to uncover you and we're going to move down and take a look at your tube. Is that okay? Okay, so Miss Smith, I'm going to go ahead and pull the covers down and uncover your stomach. Certainly I'm going to provide for privacy here and only uncover the tube in any areas that I need to be able to assess. Now, if you'll remember with the abdominal area, you always want to inspect first, and so I'm going to be looking at her abdominal area. I'm going to make sure that I don't see any distension, and I need to make sure that there aren't any open wounds or areas. I need to also look at the tube, and I need to assess the appearance around the site. Now, if this tube has just been placed, you may well see a suture around it. Tubes that are more established probably are not going to have sutures here to keep them in place. If it's a new tube, you might also see a dressing that is pre-cut that goes around the tube. You may not see that later on. It depends on facility policy. You always need to assess the area here for excoriation. And of course, you might need gloves if you're going to be moving on to the palpation piece and touching anything. I'm noticing that she doesn't have any excoriation. Mrs. Smith, how long have you had this tube in? And she's going to say that she's had it for at least a year, so it's an established feeding tube. Thus, there's no sutures or anything like this. There's no excoriation or any areas in here, so it looks good. Now with an abdominal assessment, then you would move on to the auscultation if you needed to do that at this point, because I don't want to do any palpation because it could manipulate the bowel sounds and change them. So if I had my stethoscope, I would go through and I would listen to bowel sounds in all 4 quadrants. I would also question her again if she's had any nausea and vomiting, any abdominal discomfort. I've noted for abdominal distension. Once I've listened, then I can come through and I can palpate if I need to do that. And so I could come through and I could palpate the areas. Certainly the quadrants would be below the umbilicus in the right lower quadrant, above the umbilicus in the right upper quadrant, above the umbilicus in the left upper quadrant, and below the umbilicus in the left lower quadrant. She tells me she's not having any pain. I'm not noting any distension. I'm not, feeling any issues as I'm going through. If I needed to measure her at this point, then I could use the tape measure and measure around her waist all the way around at the level of the umbilicus, looking for abdominal circumference. Make sure you review your facility policy. Another assessment that could be made would be weighing of the patient, and based on facility policy, you may weigh them daily, you may weigh them once a week. Certainly always weigh them at the same time, and your patient should have a nutrition consult because this patient will be receiving tube feeding, so we want to make sure and keep an eye on her and see how she's doing with that. The next thing I would need to do is confirm placement. So as I'm going through this, I've certainly got a tape measure here, and with the gastric tube, I'm going to measure from the level of the insertion site to the actual end of the tube. And I would need to make sure and make a note of this and the length and record it in the patient's chart and compare it with any measurements that I had before. Also making sure that it does not appear that the tube has migrated any and that the length is the same. One other way to confirm placement is whenever I check for residual, I can check it with the pH paper. One thing that you need to make sure you remember is that if my patient is getting tube medications or if they're getting tube feeding, it could potentially alter the pH of the patient's gastric secretion, so you need to be aware of that. So we're going to say that I've measured the length, and this is consistent with what has been predetermined for Mrs. Smith and what the other nurses have found when they've come in and done their assessments. The next thing I'm going to do is go ahead and move on to check gastric residuals. And in doing that, I'm going to go ahead and prepare my equipment. So for her, I'm going to go ahead and I'm going to take a waterproof pad and I'm going to go ahead and put this down underneath the tube because this can get messy and making any issues here or getting her bedding dirty or getting her dirty. And I've got that down. And then certainly I need to have established with her how she needs to communicate with me if I need to stop during the tube feedings, if she starts having discomfort or feels sick to her stomach. Certainly I could have pre-medicated her if she was having any pain or nausea. If she had any issues that were abnormal assessments before I started with the feeding, it might warrant that I call the physician if she had abdominal distension or was not feeling well, because that might warrant holding the tube feeding. At this point, if I needed personal protective equipment, I could put this on. At this point, if Mrs. Smith's condition had warranted personal protective equipment, certainly I would have entered the room wearing it if she had MRSA or VRE or C. diff or any of those things. But if her condition did not warranted and it was not needed, I could choose to wear personal protective equipment at this point if I wanted to do that. And sometimes I will wear it because you can end up having splash or leakage or something like that. So just in addressing that. Some of the other equipment you will need, certainly I already used my tape measure to confirm placement. Whenever I actually am assessing and accessing her tube, I'm going to use what we call barred piston irrigation tray set, and you may have some different type of material depending which facility you use, but this actually comes with the piston irrigation. It has a little container that you can put your warm tap water in for your irrigations and things, and it's got a little tray in here. Certainly I've got an emesis basin and I've got some pH paper in here, because if your facility policy requires that you check the pH on the gastric contents, then you would need this. And then if it's a brand new gastric tube that has been placed, whenever you first come in, you could use an indelible marker to measure and mark the length of the tube. And so this is here. Now, as I'm going to be giving the tube feed, then I would need to have whatever tube feeding that I have. And at this point, I'm going to give what we call a bolus feeding. So you need to make sure and confirm that this is the correct type of feeding that is ordered for your patient. You need to check the expiration date and make sure that it is within the date and time. You need to make sure that it is a closed container. Okay, and then if you're using cans of food, these need to be disposed after each feeding. You cannot hang on to them once they've been opened, because they lend themselves for bacteria, and then you could infect your patient. I'm going to go ahead and I'm going to refoam my hands here before I get started. I'm going to again ask Miss Smith if she has any questions or concerns before we begin, and she says she's okay. She says she's not having any pain. She's not sick to her stomach. Now, as far as positioning of your patient, you need to make sure, of course, always that their bed is locked. And then I need to raise her to my height if that is appropriate, if I need the bed higher. So I'm going to go ahead and do that. Make sure you always save your back. And then as far as positioning of her, if I'm going to give feedings, I need to make sure that she is at least 30 to 45 degrees in height. And if this is an intermittent feeding, which it is, she needs to stay at this height for a minimum of an hour after the feeding. If the patient has continuous feedings going, then she always needs to be maintained in a height of 30 to 45 degrees, unless there are contraindications for that. One of the reasons for keeping the head of the bed elevated is you prevent the patient from aspirating and having further complications. She says she can tolerate this position. I've got her sitting up between the 30 to 45 degrees. I'm going to go ahead and grab my gloves at this point. And of course, this does not require sterile gloves. This is not a sterile procedure. So what I'm going to go ahead and do, I'm going to move the table around here for my use, and move my equipment around so that I can get to what I need to get to. So the personal protective equipment and these other things I can move. I'm going to go ahead and open up my piston irrigation tray set. If I do not have my trash can over here already, I can go ahead and move this with my feet. If you end up having to touch the trash can, then please make sure that you take your gloves off, refoam. As I open up this set, I'm going to go ahead and assess it for equipment. Again, this is not a sterile field. It does not have to stay sterile. It's not a sterile procedure. As you look at the kit, you need to make sure that you're assessing for it. You should have a piston irrigation syringe, and you'll see it has markings on it. They do have an extra little piece here for the length, and some of the gastric tubes may have smaller connecting points that you might need this. So I usually put it down in the tray and come back to it. I usually kind of manipulate the syringe a little bit because if this is the first time it's been used, it may be hard for, you to pull it and move it. And then I'm going to go ahead and look at my container, and this is what I would put my warm tap water in. So we're going to say that I've already got some warm tap water in here. Now this depends on facility policy for what you need to flush your tube with, as far as after I've checked residual and all that. Typically, you are going to use this tray to hold your residual if you get any. So I might well want to move the little cap over here to the side so that it's not in the way. Now, this equipment, you need to make sure you look at your facility policy for how often it needs to be changed, but most of the time it needs to be dated and initialed and changed every 24 hours. These things can harbor bacteria, and so you want to make sure that you're keeping up with it so that you don't introduce bacteria to your patient. So I've now got my set opened up. I've added my warm tap water per facility policy. I've got my tube feeding over here.